I'm Thomas Baldrick here at ATS 2015 in Denver. Happy to have with us again Dr. Richard Channick from Massachusetts General Hospital. Thank you, sir, for stopping by.
Thanks for having me.
So you're presenting a poster on the prognostic indicators of outcome within the SERAPHIN study. What variables seem to have significance here?
Yeah, so this was a study really looking at follow-up data after this very large study we had done with this novel agent, macitentan. And we had the opportunity, because this was a study of over 700 patients, to do a lot of different post hoc or subgroup analyses. And what emerged from that particular analysis were some of the things you might expect would be prognostic, like renal function, degree of dyspnea, held up. But one thing that was novel or new was it appeared that the use of diuretics in this population was associated with a worse prognosis. And that is a previously unrecognized prognostic factor.
How did that come up?
I think you look at a lot of data and think about what might be significant, and this was just one that turned up. I think it's one of the challenges when we deal with these patients is really to try to predict in the patient up front who is in a more serious category, and that may impact on aggressiveness of therapy and those type of things. So I think it was an interesting finding for sure.
Is there a hypothesis why patients with high creatinine and use of diuretics would have an increased risk?
I think, yeah, one could certainly generate hypotheses. Certainly as heart function worsens, that may affect the kidney function. And elevated creatinine can be due to poor heart function, could be due to congestion of the kidneys from volume overload, and maybe that's the link with the diuretics. And obviously, patients on diuretics are potentially likely to be sicker because they need the diuretics, and that may be why they're in a worse prognostic category. Is there some independent reason why diuretic use might be associated with worse prognosis? We don't know. This is, post hoc data analysis, but it's what we call hypothesis generating, in the sense that maybe one needs to look at this further in prospective studies.
How will you try to build upon these findings?
Well, we're discussing it. I think that we have to sort of scratch our heads, and I think we're still at that head scratching phase where we're going to think about what kind of trial or study we might do moving forward.
Very much. Thanks for stopping by. Appreciate it.
My pleasure.